Welcome, everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine podcast. I'm Yaron Ivan, your host, Pediatric Emergency Medicine physician in Orlando, Florida. And today we're going to continue some discussion of some very important rules, and we're actually starting a new category. I call this category Communication Tips and Tricks, Part 1. Rule number 52. Don't tell people what you want. Tell them what you need. This is something I learned during residency, where for the first time I was the senior resident in my second year of residency, and for the first time after being a doctor for barely 12 months, I found myself managing a team of 2 interns, 1 or 2 medical students, and a bunch of sick kids. It was not easy. I remember being puzzled and surprised. Why do they seem reluctant to do things when I asked them to? For example, when I would send the intern or ask the intern to go to the ED and admit a patient, he or she seemed very reluctant to do it. I was very surprised by it. One of the advice I got at the time was, don't tell people what you want. Tell them what you need. So saying something to the interns, hey buddy, I really need you to go to the ER and admit this patient. I need your help. I would appreciate if you did that. As opposed to, I want you to go to the ED downstairs and admit this child. I find that when you tell people what you need as opposed to what you want, you possibly come across more genuine, compassionate, and nice, and they're more likely to do it, especially if the relationship between the two of you is good. So, rule number 52, don't tell people what you want, tell them what you need. Rule number 53, give the consultants or the admission physician a good story, even if they don't ask for it. This, I think, is a professionalism issue or advice. It's also something that I do in order to lead by example. I imagine it's fairly hard to sit at home and evaluate the patient remotely when you are a consultant or a specialist sitting at home. Basically, those people have to rely on my history and physical exam in order to make some important clinical decision on a patient that I'm seeing in front of my eyes. If I want this call to be beneficial for myself and for the patient, it's better to give them a very good, comprehensive presentation so they can help me and make good clinical decisions and help the patients. So when I speak to a consultant, I literally sound like a medical student. Chief complaint, HPI, past medical history, etc., physical exams starting with the vital signs. Very important. It's the same when I call the hospitalist and I tell them about a patient I'd like to admit. I literally sound like a medical student. I give them a good story to justify my admission so we are all on the same page. This is a good rule to follow, especially if your residents are listening to your presentation and your conversation with a specialist. It's just simple leading by example. So rule number 53, give the consultants or the admission physician a good story, even if they don't ask for it. And I gotta say, sometimes I speak to the consultants, let's say surgeon, and halfway through my presentation, they say something like, Dr. Ivan, can you just tell me what the CT shows? If that's what they say, no problem, I'll skip. But from my standpoint, I start, like I said, as a medical student, chief complaint, HPI, past medical history, etc. Rule number 54, set up your consultants for success. Many times in the ED, I consult certain specialists to come help me take care of a child or just to get their advice. Sometimes it's by phone call, sometimes they actually plan to come to see the patient in the ER, but I always set them up for success. A classic example is when I call the surgery resident to come and see a patient after I just diagnosed appendicitis or I strongly suspect it. Needless to say, the child and the mom or the dad are probably very anxious and worried. I think it helps putting them to ease if I say something like, Mom, now that we know little Maggie has appendicitis, I'm going to call our pediatric surgeon on call. He is excellent. He does this literally every day, which is true, by the way. So your daughter is in great hands. I truly believe that saying something like this puts the parents and the patient at ease and helps facilitate their care. Now, I have a mom who's more confident in our care and just feels overall better. Another good example is, let's say I just diagnosed a child in the pediatric emergency department with acute kidney injury. elevated creatinine for whatever reason. And I'm about to admit the child, probably would. Maybe I sense something like, Mom, it looks like Maggie's kidneys may have been hurt, but no worries. I'm calling our pediatric kidney doctor right now to get his advice. This is what he does for a living, and he's going to figure this out. Your daughter is in great hands. Same thing when I admit someone after a negative workup in the ED. Mom, upstairs there are doctors called hospitalists. They are diagnosticians. They're very smart, and they will figure out what little Maggie has. They will pinpoint the problem and treat her appropriately. Your daughter is in great hands. I feel like saying those kind of things help builds up the confidence that the parents have in our care and set up my consultant for success. So when they go upstairs for admission, now I have a parent who already trusts their hospitalist and the care they're going to get. Rule number 55. Be a doctor and an advocate for a patient. Give the patient what you think they need. This is something we all do by default of taking care of children every day. But sometimes we need to do a little more. Again, I can best explain this rule with an example. So a few months ago, I treated a child in the emergency department with a fairly serious dog bite. Patient's forearm was fairly deformed with an open wound with visible subcutaneous and muscle, and this was unfortunately done by her own dog. I treated her to the best of my abilities. IV analgesia, extensive irrigation, x-ray to make sure the bone is not involved, prophylactic antibiotics systemically, etc., etc. I then called the hand surgeon with the plan to admit the child so he can take her to the OR, which is what I thought she needed. When I called the surgeon, perhaps I did a bad job, maybe a very bad job, describing how serious the injury was. He said something like, "Great job, Dr. Ivan, appreciate it. Why don't you give her some oral antibiotics prescription, and I will see her first thing on Monday a.m." This was Friday afternoon, by the way. In my mind, given the situation, this was a very suboptimal solution. The child, in my mind, needed IV analgesia, had a hand that was fairly deformed, a wound that is very high risk for infection, etc. I then said back to the surgeon, "Sir, I appreciate your help, but I respectfully disagree with this option. I think the child should stay in the hospital for systemic therapy, analgesia, antibiotics, etc. And I think she will greatly benefit from your attention in the OR." He disagreed and insisted that she can be discharged. Remember this, the patient in the emergency department is always your patient, and you have to do what you think is right for the patient. You can't make a consultant come to the ED, you can't make a surgeon take the patient to the OR, but you can try. You should always try. You should always advocate for your patient so they can get what you think they need. So remember rule number 55, be a doctor and an advocate for your patient. And that's it for today, guys. Thank you again for tuning in and listening. Let's review what we learned. Rule number 52, don't tell people what you want, tell them what you need. Rule number 53, give the consultants or admission physician a good story, even if they don't ask for it. Rule number 54, set up your consultant for success. Rule number 55, be a doctor and an advocate for your patient. And that is it for today. Thank you very much for listening and tuning in. I appreciate it. Please feel free to check out pemrules.com and submit any feedback or any request you may have. I hope you enjoyed the show and see you next time. Have a good day.